Hi everyone, this is Garner here. It's time for another pose of the week. This week we're going to look at a lateral child's pose, or what I call kind of a resting side bend, because this is what it will look like, but you're going to be in a child's pose position. This pose is excellent for a lot of things, but I want to focus in on some specifics. What we're going to talk about is why it's good for the pelvis and the hip, because that is our weekly focus. So the question is, what's happening in lateral child's pose and why would it be good for this area? First, we need to set it up. We want to avoid foot drop in this pose, which means sitting back on the foot for so long that it begins to get numb and go to sleep. Now, that can be a permanent injury, so obviously we want to avoid that. You can use a scarf or a hand towel, whatever you feel like might work best. I'm going to use a scarf here, and you're going to roll it up like this, tightly rolled, so it gives you just enough of relief in the ankle that you can avoid that foot drop. One other piece of equipment that you might want is just a myofascial ball. This is not a fancy ball at all. These are what I give out to my patients. It's an inflatable, deflatable ball, so you can put as much air or as little air into it as you need. Another reason this is good for this particular pose, is great for the pelvis and the hip, is because you can actually do some abdominal massage, better known as visceral mobilization, which I do as a pelvic and ortho PT. So you can put the ball in different areas, okay, this just following the intestine, for example, the large intestine, to help relieve some of the issues and discomfort and pain if you're having that, okay, if you're having gut issues. Because if the gut isn't happy, nothing's happy. So I put this rolled scarf up under my ankles. Now, I've not had, in 25 plus years of practicing yoga, I haven't had a foot drop issue, but I don't want one. Okay? So if you feel like you need a little bit more, you don't want to use a yoga blanket. That's too thick, and you don't want anything under the foot or under the leg, just under this kind of axis of rotation for the ankle. So what's happening in the pelvis? We want the pelvis to be, the pelvic outlet to be more open. Think when women give birth, squatting is going to open the pelvic outlet. Laying down and putting your legs up in the air closes the pelvic outlet. No good. So we want to do this pose to open the pelvic outlet, to release the pelvic floor and enhance the piston breath of belly breathing, which means when I inhale, this happens. Okay. When I inhale, diaphragm up here goes down, pelvic floor goes down when I inhale. A lovely thing, and then comes back up as I exhale. We're going to accentuate that in this pelvic outlet opened position. Let's just say I had some different discomfort going on in a certain section of the intestine or abdomen, or maybe it's a hip flexor that's snarky. Maybe it's a snarky psoas, as I like to call it. So you'd put it in that area, right on the inside of the hip bone. Now, obviously, you'd want to work with your physical therapist, preferably one that specializes in the pelvis and the hip, to get it completely therapeutic and right for you, okay? So this isn't a prescription for anyone, but feel where that may be if you have that. I'm gonna put mine over here. And for this resting side bend, it's very specific. You want to interlace the left hand. If I'm going to the left, let's just say this area needs a little bit more opening. Left hand over the right. Draw the arm, the right arm out of the body, and I want you to rest your head on your left arm. So that way you're not shearing your cervical spine, and you're almost rotating a little bit, okay? Rotating towards the camera. And that ball, that fascial ball, is just kind of caught up between my leg and my abdomen. And then you're belly breathing. You want to spend more time in this pose because it's a restorative pose. And you're going to be drawing that arm out of the body without creating impingement in the shoulder and without creating impingement in the hip. So if you have thickness in this area, which I often find when I'm seeing patients, you need to work with your therapist to down train that and get that to relax. This is a pose that can help it, but you don't want to create impingement here. So make sure the knees are more separated, maybe the feet are more separated. Give this area a massage if you need to. You can also put your thumb into the hip crease and kind of draw that hip back and out and give that a little bit of relief, okay? I have had hip and shoulder impingement. I know what it feels like. Okay? So when I use yoga as prescription, medical therapeutic yoga, I'm very sensitive to the needs of patients when they have that issue. Okay? The last thing I want to point out about this pose that's good for the hip and the pelvis is that you're opening up the intercostals. You're using that piston breath, that deep belly breath, and you're creating length through this area. Okay? Are we really, quote, stretching the area? We don't really know that for sure because the science of flexibility is complicated. But what we do know is that we can change the sensation that the tissue feels there. We can create a sensation of safety so that the fascia and the other muscles and all of the other, neural and vascular structures feel safer, so they're not so reactive and pulling back on you all the time. As we get older, we get rigidity through this area, so this is wonderful to maintain that mobility. And of course, when you come to the other side, interlace right hand over left, draw that out of the body. I could switch the ball if I wanted. Head resting on the right arm. And of course, I feel like staying here for about 5 minutes. And so this is where I'll leave you. I'm going to continue on in this pose. And I'll see you next time for Pose of the Week. You can always visit my blog in the meantime to visit the past or read the past posts, integrativelifestylemed.com. And if you're looking to work with me directly, you can get in touch at drgingergarner.com. I do free consults there. All right, till next time, see you later.